Let me listen to the pharmacist.
Mm-hmm.
You understand? And this is also showing respect, a level of responsibility. I cannot be on the phone and I'm in someone's office and you're trying to help me and I'm on my phone while you're trying to do something. No, this is disrespectful. Ask excuse or something if it's very important. But other than that, you need to listen.
Okay, so we'll take a break now and we'll be right back after a word from our sponsor. Leana sorti Dr. Kuti Hasbury ma we number 1 mali pièce biology en letema mo idi c'est eulogy idi number 2 pa mette mo asu ice mo hani of wedi ma we di gati sortu ka pali no speak life man ve mene ali da côté quick care pharmacy là you want to là c'est what this year yani ouvert pour 72 hours of sleep because everything about quick care pharmacy speaks of life plus nani bell clean spacious plants differently staffs your medicament pa ko the air condition c'est what this your oasis in a desert land you just want to sit and relax and enjoy the health education corner about current health issues. Go to Quick Care Pharmacy Halsbro, set up your blood pressure and sugar check one time and get your top up too. And I you put 20 on my cell phone. And of course, over the counter drugs and prescription drugs. Après and ID moins depuis joie aller côté Quick Care Pharmacy. Her outlook on life has changed. If you battre any buy medicine, may you parley buy. Actually make aller exercise tous les bons matins, can leave him away. Get up, lazy Harry. Harry him toujours a dit il a si carry on last sir. The last shall be the first Harry. Move that body Harry. Quick Care Pharmacy ka ouvert Monday, Wednesday, Friday from 9 to 6 and Tuesday, Thursdays and Saturdays from 9 to 4. Okay, welcome back to Tablets and Spoonfuls on your radio. Today we're talking about timing, the right timing for your medication. And that is so important. We continue with another category of drugs now.
Yes, we are looking at high blood pressure. The blood pressure shows a 24-hour rhythm during the day. And it lowers during the nighttime when we go to sleep. But after the age of 55, many people have blood pressure that does not exhibit or show this nighttime dip. We call it a nighttime dip. It's a condition called non-dipping, whether the blood pressure falls at midnight compared to the day. Okay, so people after 55,
your blood pressure will be low at night.
Yes.
But when you reach 55, the age of 55, then it changes.
It changes, right. So at this point, we're asking, when is the best time to take the medication because of that? So you find that most individuals might be on 1, 2, 3, 4, 5 different blood pressures medications because they all work differently to achieve the same thing. So at least one blood pressure medication should be taken at bedtime. An example of a group of that medication that's very commonly used is called ACE inhibitors. We have like the lisinoprils and the captoprils. What those drugs do, they relax the blood vessels and they promote the kidney excretion of salts and water. Okay, it's done quite effectively during the night time. That's
why you get up and urinate sometimes.
Well, yes, although that one is not particularly as strong in that area as diuretics, but it's also helps.
Drugs like Lasix.
Yes, furosemide. Right, they're diuretics. They work along a certain part in the kidney. But this one, what it does is to relax the blood vessels, and it promotes the excretion of the salt and the water. We have something else called the ARBs, but an example of one that we commonly use here in Dominica is losartan or valsartan. We see that every day. They have similar activity like what we just called the captopril and the lisinopril, but it's used if one cannot tolerate the side effect of the ACE inhibitor. One of the common effects of ACE inhibitors like lisinopril or captopril is cough. You find people always complain, I have a dry cough, a cough when I'm on that medication. If you cannot tolerate that, the doctor might put you on losartan, which is you have less side effects and you can better tolerate it. And it is most effective when taken at this time in the night. So that is why I always recommend to my patients, when you take when you're on the losartan or the ACE inhibitors, you take them at bedtime. Why? Because for the same reason we say non-dipping is a major risk factor at that time. And dipping is a risk factor because it can cause stroke, heart attack, kidney disease. So taking 1 to 2 of your blood pressure medication at night reduces the effect significantly.
Okay, so when we say dipping, of course, we understand what we mean. We're not talking about when we used to go to a fair and dip.
No, we're not talking about that. We're talking about the rhythm of the blood, comparing the rhythm of the blood from the daytime to the nighttime. It changes. It's normal to change below the age of 55, according to experts. But once you're 55 and above, we don't get that deep.
That deep, yes.
Yes. So if you're hypertensive, it's a little higher.
Night.
Right. So we want to prevent or reduce the risk that's caused by dipping. And so the best time to do that is at night, because that's when we have that dipping effect.
Can I ask, do people get strokes more often at nights?
Well, I have not come across any research really that would prove that. But because of that effect, because of that dipping,
we call dipping syndrome or
syndrome, that's the word I probably want to use there. Because of that dipping syndrome, it definitely would increase the risk more so for having strokes and so at nights in persons above 55.
Because you get sometimes people go to sleep and they never get up.
Right. It could be a number of reasons. It could include that as well. You understand? So if you're hypertensive and you're on your hypertensive medication, ask your pharmacist when is the best time to take it. Most people that I come across too, if I don't explain to them when is the better time to take it, they tell me they sit and they take everything in the morning. So sometimes I have to break it down to them and let them know which ones is better to take in the morning or at nights. So you're covered either way. You understand? So it's important to ask your pharmacist, speak to your pharmacist, speak to your doctor, what is the best time of day that I should take that. Because some people have 6, 7, 8, 9, 10 medications taken. And they may, and some of them might during the morning and within 3 hours take all. You understand? Or take all one time. So it's important to know that. This is why.
I think of that sometimes. I mean, doesn't that affect the stomach or
well, it depends.
The mixtures, the different chemicals.
It depends on. Yes, it's very possible.
Stomach, but your whole system, can it not affect you?
Of course.
I mean, if you lose the boilers, what do you put tablet?
Yes, of course it can. But it depends on the different categories of drugs. It depends on if the drugs they're anti each other. That can cause a problem because they're fighting. Yes, they're fighting for the same what we call in space. The same pharmaceutical receptor site where they have to attach on the cell that they have to attach to. Some drugs might be fighting for that same site on that cell. That might cause some problems. Some drugs might be in excess and may be eliminated, cause some to be eliminated. Some will cause some to be non-effective. So then you don't get the effect of the drug. Some might increase the efficacy of the drug. So instead of the drug being a 5%, it could be increased to a 10%. I'm just using a rough number out there. So understanding how to split it and timing your medication is important. For example, like the eye drops, I tell the patient most times, they may have 2-3 eye drops to use in the same eye. You cannot use every morning. You cannot use it at the same time because one is going to wash out the other. So you need to take at least 5, 10, 15 minutes.
Yeah, I mean, that's like common
drop.
sense.
Yes.
You put in an eye drop, you put another one.
Yes, you just washing out the other drop. But some people don't.
Yes, I agree. That's my medication. Dr. Bamo medicine, money point.
So that's important. Understanding that is important.
That's why it's so important to talk to your pharmacist.
It is important, yes. It is important. So this is what we recommend for high blood pressure. Taking at least 1 or 2 medicines at bedtime would help.
Okay, and there's also another group of drugs that you want to talk about.
Yes, we want to talk about osteoarthritis. Very, very, very common in Dominica. It's a disease of wear and tear. It's a degenerative disease of the joint. Yes, so it's very common. As we grow older, everybody's complaining. All right, you're saying that better than me. Yes, exactly. So we want to look at that. So that's a
great. But then too, you have to be careful what you say to words. Yes, are powerful. Speak life to your pyjama.
Life to your pyjama. I agree with that. Yeah. Yes. It is not deteriorating. Yes. You're not deteriorating. You're not. You're there.
Words are important. People continue to tell me, "Oh, my finger on the road." I do not say, "Oh, my finger." I suffer too much in my finger. I got toothache in my fingers. Bagoban. Paddy more my finger. Paddy sir.
Yeah, no more my finger. No. Yes, my finger is healthy.
Right.
That's right.
Strong. I mean,
speak life. Speak life. Let's speak life.
You get a toothache.
Yes, because the Bible tells us that the
life and death
is in the power of the tongue. So imagine. Yes. So let's speak life. we might see the symptoms manifesting itself, but we still need to try and speak life.
Right. Yes. Some people say, you
continue to have. Yes. That is true.
They never die quickly.
That is true.
And they see plenty misery.
That is true. So
let us trap you.
Yes. Let us try and focus in the season right now about life.
Life of
Resurrection
Christ. Power.
Amen to that. So the gradual deterioration of the cartilage covering the bone and the end within the joint causes pain, tenderness, swelling, around the joint area, what we call inflammation. So people can experience pain at different times of the day when they have osteoarthritis. So we're going to ask, when is the best time to take it? Because we all experience it at different times of the day.
And I would think also when it's even colder too.
Yes, whether it's cold, whether it's hot, yes.
Yeah, but some people tell you when it's very cold.
Like Christmas time, they get more joint aches and so, yes. So one of the common drugs that we use is something called NSAIDs. We're very, very familiar. If that's one thing that Dominicans know, is an NSAID, and the most common one is diclofenac.
Okay.
So we have
diclofenac. Everybody knows about diclofenac.
That's what I'm saying. They may not know about it. They know diclofenac.
NSAID, are wondering what you're talking about.
Right. So that's why I said an example of an NSAID. The NSAID stands for non-steroidal anti-inflammatory drugs. Okay. So a common one would be naproxen, diclofenac, and they are most widely used. These drugs is best to be taken anywhere between 4 to 6 hours before the pain is at its worst.
Ready.
So they can kick in at the appropriate time. Yes, right. You know that's a condition you suffer from, so we want to take it around 4 to 6 hours before. So, example, for the afternoon pain, take it mid-morning or mid-noon or noon time. And in the evening, we can take it mid-afternoon. For the night time, we can take it before evening meals.
Because you know when your pain usually sets in.
Right. So if you know it's at nights while you're asleep, it kicks in. Then you want to take it at evening time with your meal. So you're covered while you're sleeping. Yeah. You understand? If it is in the evening time it happens, you want to do that mid-afternoon. So by evening 6, whatever time, you're covered. So 4 to 6 hours before the pain actually gets to its worst. That is why. And why we recommend that you do that is because the highest blood level of the drug will coincide with the peak pain, right? And this will offer most relief for that pain.
So when the drug is most effective at full force, then it meets the pain at that point when the pain is in its prime. So they can fight.
They can fight together.
They can fight against it, yes.
Against it, that is right. But one thing we must always remember with NSAIDs, take them always on a full stomach.
No, people will know that by now. Diclofenac, you can't just take diclofenac like that.
Yes, so even if you say, okay, my pain is in the night, so which means I have to take at evening time, I have to take the drug at evening time, and some people have this thing, I'm not eating after 6 or after 7, you're going to create a problem for yourself. You must eat something. And we're not asking you when you're taking a full stomach to have a full plate of food.
No dashing dumb way.
Because some people believe when you say take it at meal time or take it with food more so, that they have to go and sit with a plate of food. No. Have some tea, a piece of bread. Just put something in the stomach to cushion it so that the acid doesn't cause any erosion when you get the drug. So in the evening time, you want to take it for your night pains. Drink some tea, a piece of bread, some crackers, whatever, fill the stomach with something, and then take your medication. So it's important that you do that.
All right. Well, we've come to the end of another program, very interesting program, Tablets and Spoonfuls. We continue to learn today. It's all about timing and your drugs, when to take your drugs, when it's most effective. And we hope you learned something today. You can call us. Our number to call is
440-8600. But before we leave, Felix, I wanted to ask you a quick question. Let me see if you can answer that. Drugs labeled take once a day should be taken 1, all at once, 2, spaced out evenly throughout the day, 3, taken at the same time when they can achieve the greatest benefit with the lowest risk of unpleasant side effects.
I can answer now?
Yes.
I mean, I was going to tell you to repeat the question like they do on the Queen show, but that's easy for me. Number 3.
That's right. Oh, you're a very good student. You're a very good listener. That's right.
Okay, ladies and gentlemen.
But remember, if your medication label does not specify, check with your doctor or your pharmacist all the time.
Pharmacist.
Yes.
The golden rule when it comes to medication.
Yes.